athletes are supposed to be strong and stable, and when it comes to male athletes, a lot of times they experience groin pain, they experience tight hips, and a lot of pressure down in the perineal and the bottom of their pelvis. A lot of times with issues related to their penis, the perineum, the base of the penis, their testicles, and all of these point in the direction of pelvic floor dysfunction. In this video, I will be explaining to you some of the correlation between the way we work out and the muscles inside the pelvis and how these are related and what we need to do going forward with regards to screening of athletes, with regards of performing athletic sports, and also what are some of the things you can do to make the correction. When it comes to pelvic floor dysfunction, a lot of times people don't react to the first things that happen because they think it's not related to pelvic floor dysfunction. Let me explain to you. When you have chronic lower back pain, when you have chronic sacroiliac joint pain, so this is the back of your pelvis, your SI joint is right here. When you have chronic hip mobility issues, these are preludes to pelvic floor dysfunction. Of course, when it comes to male athletes, they hardly ever do anything about it. And essentially, athletes or not, when it comes to male patients, they don't do much about it unless it involves their penis. So they wait until the downward spiral has happened and now it impacts their penis or their sexual performance. And now they're like, okay, we need to do something about it. The demands on athletic training is quite high. There are a certain number of reps and sets and weights that are expected of athletes to perform when they're doing their training. And a lot of times, what matters are those statistics. So when it comes to pelvic floor dysfunction, it's any modifications from the mechanics, proper mechanics, will bring in body parts and parts of the pelvis in this example, and connected parts, meaning your spine and your trunk or your lower extremities, to perform, to give you what you're asking for, but it takes away from the proper mechanics of movement. That means your functional mobility becomes dysfunctional because your brain is trying to give you the number of sets and reps and the weight that you are asking for. The muscles inside your pelvis work with the outside surroundings of it to stabilize the pelvis, because your pelvis is the foundation to the structure above. If the foundation is not stable, you're in big trouble. If your foundation is not stable, you are not stable. So these muscles here are simply reacting to the outside. The chronic lower back issues, the chronic SI joint pain, the chronic hip mobility issues are what your body is telling you. We are using other parts to try to stabilize this, but you're not paying attention to it. Or maybe you go for physical therapy, maybe you go get adjusted, maybe you get stretched, but no one looks into the mechanics of movement, which now takes me to some of the signs and symptoms of your compensation. These can be groin pain. These can be hip mobility issues. They have you get an impression of like you have hernia symptoms, that deep achy pain that you're feeling. Your hips feel tight, or you feel pressure in the pelvis. You feel like you're sitting on a golf ball. There's tension in the perineum. Perineum is that portion of your pelvis, of your bottom between your legs, at the back of the base of the penis and in front of the anus. A lot of times you may feel pulling of the anus. You may feel experience dribbling when you're urinating. Maybe you have to push your pee. Maybe you're constipated. Maybe you feel decrease in or there is a discoloration of the penis. There is sensitivity to the tip of the penis. These are all indications of these muscles here putting pressure and irritating different parts of your body that go through here. So what are they? Well, they're the muscles, obviously. They're your blood vessels, your nerves, their joints. And so all of those, when you irritate any portion of, and of course I forgot your pelvic organs. So when that hypertonicity of these muscles put pressure on any of the things that I just mentioned, you're going to have the manifestation on that pressure showing up as certain signs and symptoms. So what would I have wished for athletes to get screened for when they are performing, when they are training? I wish they were getting screened for functional mobility. They were getting screened for breathing, biological breathing. If you don't know what biological breathing is, make sure you watch to the end, and then at the very end we'll put the biological breathing. But most importantly, if you have not subscribed to my channel, you probably should do so. It's all about giving you the tools necessary so you can police yourself. No one else cares about you as much as you do. So we can all do our very best, but you are in charge of your own body. So you need to understand what right looks like, what your tendencies are, so you can stop yourself short of committing the crime and do the fixing yourself. Better yet, don't get involved in things that will, I'm not saying don't get training. I'm just saying make your training a proper training. So I would have loved to see biological breathing or breathing assessment, postural assessment, functional mobility assessment, and seeing if they exist before the next expectation of how many reps and sets and weight you need to be lifting in your training. So when it comes to having symptoms, like let's say if you're an athlete or not, just someone who works out, you don't have to be, performing pro sports for this video to be applicable to you. I see plenty of people in my practice who just don't do their workouts right. They're too busy trying to get to the end without realizing that they're not there yet. I always say you can't skip a grade if you don't exhibit what it takes to skip a grade. So you can't be doing the lifting or the reps or the sets at the level you want if your body is not maintaining the proper mechanics as you go through the process. So the process of fixing this issue starts with biological breathing. That's the number one. That has to be the first step. The next thing is for you to understand what neutral spine is, how to create neutral spine, how to maintain neutral spine, how to go through simple movements, first on the floor, then halfway on the floor, then almost off the floor, and then fully off the floor, meaning standing up. How to perform functional mobility without losing the connection of the right body parts. You're using your body, but not using it correctly. And no one's gonna die from these things. You just become miserable as a result of the level of dysfunction. I hope this made sense. I did not give you any tools not because I don't want to give you any tools. My whole channel is all about that. But you got to understand, not every video is going to give you like, okay, everyone follows this system. Your package is very unique to you. What is in your wrong package of dysfunction that you come here with is very unique to you, and that has to be identified first. Make sure you watch my videos. Make sure you explore my channel. Make sure you educate yourself. I'm not holding any information back, but if you need any help, contact me. Use one of the methods of contact in the description box. Contact me. It doesn't matter if you're local or not. We can talk and see what there is to do to get you out of the place that you're at, and most importantly, how for you to make sure you don't lose what you have created as a result of our interaction. Hope you enjoyed this. Until next time, take care.